Hello everyone, thank you so much for joining us for our presentation as we look into what the future of healthcare will look like. Glory, Maria, Morgan, Saja, Tay, and I have all been researching this semester to dive deeper on innovation and how we can truly improve the healthcare facility of the future. Moving along into our concepts for our project, we looked into three main areas that we could improve on in innovation-wise. The first being the check-in area, second, technology, and third, the waiting zone. Diving a little bit deeper into the check-in and waiting zone concept, we really wanted to focus on the safety aspect while still looking into the patient experience. Our first question when researching was, how do we implement technology into the check-in area? By creating a mobile app, it will allow patients to fill out the paperwork in the comfort of their own car, and they'll be notified when the doctor is ready for them to come into the facility. And this not only encourages social distancing, but it also prevents the overflow of the waiting areas itself. Going into our second zone, which would be the in-person waiting areas, we created two types of in-person waiting areas. The first being the outdoor waiting zone, which will provide patients and families the opportunity to be together but still feel comfortable because they're outside and they're able to socially distance from others and have the air circulation flowing. And looking into our second idea, which is the normal indoor waiting zone, this will be provided for everyone and it will be a usable space that also still incorporates social distancing. And we looked into biophilic design for this as well. By placing trees and plants throughout the space, we researched and it is proven that it helps reduce stress and ease anxiety, which is very beneficial to the user. Going into our last step for the check-in area, which is the pre-check-in, and this is something that we have seen in the new pandemic era of pre-screening questions and temperature checks before gaining access to the buildings, and we feel as though this will be beneficial for the long term, both for the safety aspect as well as the health aspect. Going into our third and final concept, which is technology, we feel as though it is ever changing and ever evolving and truly benefiting everyone in their everyday experiences. And it is pushing the label of what innovation means for the future. Now that we're in this current pandemic situation, we have really seen the benefit of what hybrid design is. By creating media spaces for the doctors, they're able to have video calls with their patients while the patient is in the comfort of their own home and able to still see the doctor and still feel safe and secure. We really looked into all aspects of where we could implement technology by using the app on your phone, by utilizing iPads for the pre-screening check-in areas, by creating these media spaces, utilizing technology in the nurses' zones for communication. We have seen technology truly change what the future of healthcare design will look like.
As you can see here, we divided the space up between public and private spaces. The private spaces, which are the offices, the nurses' station, storage, and lab rooms. The main private spaces are located at the core of the building. So this way they can the offices and the doctors have direct access to the exam rooms. Our public spaces are the exam rooms, X-ray rooms, restrooms, and the waiting areas. We we designed 4 waiting rooms, and this is a way to reduce COVID infection and traffic.
Hello, everyone. My name is Morgan, and I will be walking you through what a patient sees as they first come onto our facility's premises. So, first off, we have changed the main entrance to the back entrance that connects to the parking deck. So, a patient will come and park their car. They'll walk down this walkway that will lead them to our outdoor waiting area. This waiting area includes a modular curved bench seating, which is an innovative way to encourage social distancing. We have also incorporated all furniture that has wipeable surfaces so that they are easily cleaned and all seating areas can remain sanitary for all the guests, as well as a COVID pre-check-in screening area. So this will be the first room that a patient will enter, and it is completely electronically ran. So a guest will check in on either a computer or a tablet. They'll have their temperature electronically checked, and then they have the option to either wait in their car, wait in the outdoor waiting area, or go further inside to the indoor waiting area, depending on whatever preference that person has. So we wanted to make it as open to everyone who comes onto the site.
Here is our materials palette. It is inspired by a concept in biophilic design, which focuses on enhancing the beneficial experience of nature in people's lives. For this reason, we've decided that the aesthetic of the space would have warm nature colors such as green, blues, and browns. Also, having wood tones and textures help us create a warm and inviting space for the patients and the people who work there.
So for the reception desk, we went for a warm toned color palette, and we also incorporated curved elements to combine all of the features of the building together. Meaning, we added a curved reception desk, and we added curved walls next to it, so we can enhance the overall aesthetic of the building once the patients enter. And once the patients enter, they have direct access to our biophilic wall, which is the green wall that we used for positive distraction to reduce stress. And yeah, that is it for the reception desk.
So this is the perspective of the waiting area that we did for our design. As you walk into the building, curvilinear walls lead you toward the reception desk. The shape was chosen just to give it an organic type of flow into the space, as well as matching the curvilinear aspects of the reception desk and continuing that visual continuity. So the hall, we made sure it was wide enough to allow stretchers to come in and out without issue. And they also serve the purpose of separating the two waiting areas and controlling the temperature during colder months and hotter months. Glass sections were added into the wall to enhance visibility and to not hinder the amount of natural light that come into the space. Because if they were just regular walls, then the light from the window would be blocked by, like a full wall. So we just wanted to allow as much natural light into the space as we possibly could. So curvilinear seating solutions were chosen for this space as a way to promote social distancing, number one, and also to match the curved design aspects that are seen throughout our plan as well. And then as you can see, like within each seating, there are many garden areas that are installed to further implement biophilic design and to really just drive our idea of bringing the outside in to promote healing. So this is the same waiting area, just from a different angle. From this angle, you will be standing somewhere near the reception desk, looking into the actual space. So just as you can see, there's plenty of seating options for people to spread out and not be so close together. For the color palette, we wanted to do natural tones just to reinforce the idea of nature being inside. So browns and greens and, whites, just a lot of comforting color so it doesn't feel too stark and disconnected.
Now, let's take a closer look at the exam room floor plan. We've incorporated natural tones that have been present in every other space of our floor plan. This is for the reason that it inspires calmness and a sense of tranquility for the patient as well as the healthcare providers, since they're practically there all day. A mediascape was also incorporated into the space. This allows the flexibility for the healthcare provider to share results, to share any lab reports, any scans towards the patient. It gives them a larger view and also allows them to share that simultaneously with their families. It just makes the overall experience seamless and easier for everyone included. Extra storage and cabinetry have been added in this space for medical equipment or any other thing that they might need in this space. Plus, we've added spacious seating, and this allows more family members to come in and get this experience with the patient. We are aware that in this moment, with all the CDC and everything that's going on, all the guidelines, that probably won't be utilized as much, but when things begin to normalize and patients that actually need companions to come to the doctor's office, all these different situations in life, sometimes there's just not enough space in these rooms to accommodate perhaps a mom that comes with 2 kids and she really needs that extra space. As we take a closer look at the rendering, we see that we have engaging graphics. Sometimes when you're being treated by your healthcare provider, they're doing something that's a tad a bit uncomfortable and you just need some distraction, and they probably tell you, look at the ceiling, look at the walls, and that is why we've incorporated motifs that have been in different areas of our space, have been incorporated in the exam room to not only inspire tranquility but also engage the eye and distract you while you're being treated. We've included plants and colors that have a natural tone because of the benefits of biophilia, and even when you don't have direct eyesight with the outdoors, even graphics of natural outdoor things will inspire that sense of tranquility. But we've made sure that every single exam room has a view towards the outdoors. While it isn't present in this rendering, as we take a closer look at the floor plan, you can see that every single exam room was placed on the outskirts of the plan towards the edges, where every single one has a window and the patient and family members can see towards the outdoors.
Here is our nurses' station's perspective. This space is centrally located in our floor plan in order to allow easy access for the medical professionals who work there. In this space, they can access their patient medical records with the new implemented technology tools in which are integrated in the workstations, and the media space where they can take conference calls if needed. Here they are also provided with plenty of storage for medical supplies as well as storage for their personal belongings.